So you know you need help and should probably talk to a therapist, but who? A psychologist, a psychiatrist, a LCP, a LCSW, a LMFT? Who do you call? If this is a question you have, in today's video I plan to go over the who's who of mental health providers so you can better decide when you're ready to pick up the phone. So stay tuned. Welcome back to my channel, where psychobabble is unbabbled. Hi, I'm Tawanda Lewis-Hazan, a licensed professional counselor, here to help you increase your knowledge and awareness of all things related to therapy and to live a life that is well, wise, and wonderful. In today's video, I'll go over 10 mental health providers. My list is based on categories of service and education from highest to lowest. And stay tuned to the end where I'll go over my #1 tip to help you better decide on who to work with. Before I go down the list, let me go over what mental health providers do. Mental health providers can help you better understand and cope with your feelings, thoughts, and behaviors. They can offer you guidance to improve your mental health so you can achieve your goals and live the life that you want to live. There are many types of mental health providers that can help you with your problems, and titles vary from state to state, so let's get into it. First up are the medical professionals, and actually the first person I'm going to go over is technically not even a mental health provider. They can be, but typically they're not. Is your primary care physician. And the reason why I start with the primary care physician is because that's the first person you encounter or you encounter frequently, and you will say to your primary care physician, I'm feeling depressed, or I feel anxious, can you prescribe something? Your primary care physician is a doctor, and what they can do is give you a brief assessment, enough to provide you with a medical prescription to help with some of your mental health issues. And more than likely what they will suggest or encourage is that you see an actual mental health professional and give you a referral to do that. Next up is the psychiatrist, which is what most people tend to think about when they think about therapy. Per the American Psychiatric Association, a psychiatrist is a medical doctor whose focus is on mental health. You may see MD or DO behind their name, and of course MD stands for medical doctor, and a DO stands for Doctor of Osteopathic Medicine. Their education focuses on psychiatry, which is a branch of medicine that deals with the diagnosis, treatment, and prevention of emotional, behavioral, and mental health disorders. Because psychiatrists are also doctors, they can order or perform a full range of medical, laboratory, or psychological testing. For someone to become a psychiatrist, they must attend medical school and take a written exam for a state license to practice medicine. And then they complete 4 years of psychiatry residency. And after completing residency training, most psychiatrists will take a voluntary written and oral exam given by the American Board of Psychiatry so they become board certified. In the #3 spot are nurse practitioners who specialize in mental health. These practitioners are also known as advanced psychiatric nurses or psychiatric mental nurse practitioners. Since I'm in Pennsylvania, I'll share the scope of practice per the Pennsylvania Coalition of Nurse Practitioners. And actually for this, I'm gonna read word for word what that says. Nurse practitioners may diagnose mental health conditions, develop and implement treatment plans, order and perform diagnostic tests, and deliver other healthcare services pursuant to collaborative agreements with a licensed physician. And an NP may prescribe drugs, devices, and certain controlled substances as outlined in the written collaborative agreement with a physician. Okay, in the #4 spot are the psychologists, also who we think of when we think of therapy. Psychologists hold a doctoral degree, and they will either have a PhD or a PsyD, and thus they are called doctors also, but they are not medical doctors. The PhD and PsyD's graduate level education focuses on psychology, and once finished, they will gather 3,000 hours of clinical supervised experience and sit for a clinically approved examination to be able to practice psychology, both of which can diagnose, monitor mental health conditions, provide clinical counseling, and administer psychological tests and evaluations. And in some states, some psychologists can also provide medication. The main distinction is that a PhD may gravitate more towards research while a PsyD's main priority is clinical. Now next up are the licensed professional counselors or therapists. Now everybody I'm about to go over in this category all have master's degrees and they have accumulated 3,000 hours of clinical supervised experience in the field, and they pass an approved clinical examination to be issued a license by the board in their respective state. Licensed clinical therapists or counselors can all diagnose, assess, and treat a variety of mental health conditions, typically through psychotherapy, or a big fancy word for talk therapy, the same as psychologists. But what they cannot do is provide medication. To fill this need, they will probably work with a doctor or a nurse practitioner who can prescribe and monitor medication if that's part of your treatment plan. In the number 5 spot are the LPCs, and that's what I am. I have a master's degree from LaSalle University, and after graduation, I worked for Community Behavioral Health, where I collected 3,000 hours of clinical supervised experience, and then I went on to pass the National Counselor's Exam on the first try. And I'm licensed in the state of Pennsylvania where I practice psychotherapy. So some of the things that I do is assess, diagnose, and treat many mental health conditions. I also develop treatment plans in collaboration with patients based on their goals for therapy. And I offer strategies, tools, and evidence-based interventions to help you meet your goals. So in the number 6 spot are LCSWs, our licensed clinical social workers. And in fact, they are the oldest master level clinicians in this category. So they work extremely similar to LPCs. However, their master's education focuses on social work, and that is the lens in which they see things differently than, say, a LPC. In the number 7 spot are the LMFTs, or the licensed marriage and family therapists. And similar to the LPCs or LCSWs, they have a master's level education, but the distinction and focus is on family dynamics in relationships. And last but not least are counselors who may have some additional training in a specialty area. They may conduct screenings, assess needs, and provide brief therapy. What they cannot do is diagnose or formulate a treatment plan without some sort of oversight or supervision. So in the number 8 spot are counselors in general who are not licensed. And typically many agencies and institutions will hire undergraduate or graduate school students who are either working towards their degrees, or if they're postgraduate, they may be working in general or working towards their license. Know that these counselors are dedicated professionals who can be very helpful at helping you address some of your mental health concerns. Now, in the number 9 spot are school counselors. This is a bit of a mix because, like LMFTs, school counselors have a specialty, of course, in school psychology. You may encounter a school counselor who may have a bachelor's degree, typically a master's degree, or a doctorate, which of course would be a psychologist. Now, all three will be able to provide some school counseling, but a school psychologist will be able to diagnose, treat, and provide psychological testing. And finally, number 10, the drug and alcohol counselors. Drug and alcohol counselors are people who work with individuals who want to reduce or remove their unhealthy behaviors that resulted from their dependency on destructive substances. Now, substance abuse counseling is a specialized and challenging field with its own certification. And unlike other counselors who hold a bachelor's, a master's, or a PhD, drug abuse counselors do not need a college degree. Now, if you're someone that holds a high premium on education, please don't let this dissuade you from working with these types of counselors, because an individual who pursues a career or training is not doing it for the paycheck. Typically, these individuals have a very visceral reason for wanting to work with this population, and they are very committed to helping people overcome this mental health issue and improve their lives. So that's it. These are the top 10 mental health providers that you typically will encounter when you're looking around for someone to help you with your needs. And now, my number 1 tip for picking a provider. You really have to pay attention to how you feel when you're with the person, because you should feel comfortable enough to want to share difficult parts of your life and your mental health journey with this person, because you will be working very closely with them over time. Therapy lasts 45 minutes to an hour once a week for several weeks. until you feel better. And all mental health providers, regardless of their title or education, should possess, to some degree, the ability to effectively listen, empathize, communicate, build rapport, analyze and problem solve, be authentic, compassionate, patient, and open-minded. So when you're looking to work with a psychiatrist, a psychologist, a LPC, a LCSW, a LMFT, no, it won't feel majorly different since a lot of our education and background and requirements are all very similar. We will all work one-on-one with you, talking about your issues and concerns and helping you reach your mental health goals. Now, what will make us distinct from one another is our area of focus. What is our specialty? What populations do we work with? These are some of the questions you want to ask your potential therapist in a phone conversation or in intake. In a future video, I plan to go over more deeply some of the questions you should ask a therapist before you begin a therapeutic relationship. So be on the lookout for that. Whew, that was a lot. So feel free to review any part of this video, or if you have a question, please ask in the comments below. I will try to get back to you as soon as possible. Before I go, the bonus that I promised you earlier in the video can be found in the link below. What it is a cheat sheet of the who's who of who can help you regarding mental health providers. And as always, if you found this content to be helpful, please like it, subscribe to my channel, and hit the notification bell so you never miss the latest content. And if you think someone else will benefit from this type of content, please share it. And until next time, I hope you will be well, wise, and wonderful.